Hello guys, and welcome back to this video. And over the next couple of weeks we're going to be dealing with trauma. So what is classified as trauma? Well, trauma is any kind of physical injury dealt on the body. So you get emotional trauma as well, but for our videos we're going to be dealing with physical trauma. So where can incidents happen? A lot outside. If you work from a building site, farming, as you can see we're outside this evening. Our scenario is going to be based outside. So keep an eye out over the next couple of weeks as there'll be most interesting videos. Get the ladder. Yes. Have you the Christmas lights there, Kevin?
I do.
Okay, so you want to be careful here. Why we're putting them up in November, I don't know, but hold on a second, I will extend that up some of it back out so we won't get the top ones there. Right, you're sure you're okay up there now in height?
Yeah, I'm fine.
I'm just a bit older now. I'll put this. So what we're doing then is we're putting the cables up. Look, it's only up the top of the eave there. You happy with that?
I'm happy, yeah.
Right, okay, so go on the way up. So I'll take it out.
Dad, will you get me the pliers?
Oh, will ya? Give me 1 second there now. Can you go up? You alright there?
Yeah, I'm fine.
You sure you're safe?
Yeah.
Okay, I'll just go off and get you the plier. Dad, Queen, are you alright? Queen, are you alright? Well, can you hear me? Marie, get an ambulance, quick! So here we have a typical scenario. Somebody went up on a ladder and fell off a ladder, and the person's after falling about 2 meters, roughly about 7 feet onto the ground. As you can see by the impact on the ground that the patient is unresponsive. Question is, what would you do next? Take a minute to think about it. Here we have our patient on the ground. The first thing I'm going to do is making sure that I'm not going to rotate the patient's head. If you notice our patient is unconscious on the ground, and what happens is his coat is actually holding it. If I have an extra person here, what I can do is I can get them to hold the head, or I could use flower pots or anything like that around just to hold the head. I notice that my patient is breathing. I can see his rise and fall, and I'm going to check for a pulse as well. His airway is not occluded, but I have to be very careful in a trauma situation that I don't do a head tilt chin lift like I normally do when I'm doing, we'll say, CPR, because it could be trauma related. If the patient stops breathing, that's a different matter. Now, another thing we're going to do here is we're looking for any kind of deformities on the body. So on a quick scan down along, everything looks in order. Another thing I'm going to do is a quick head to toe. So when I come along, ideally I'm going to round the head here, cross the eyes, mouth, in around the back of the neck, checking the throat. I'd open up this, but it's cold out here this evening, and so also we want to be very careful about our patient as well, and we have to be very careful on hypothermia as well. So we're going to do a video on that in a couple of weeks' time. Another thing then, we're going to check the belly, making sure that the belly is soft, and if the belly is nice and soft, that's a good indicator that there's no abdominal injuries there as well. Another thing we're looking at then is the pelvis, and make sure that you don't go. So lots of people years ago were taught how to spring a pelvis, and they'd push and they'd shake. I would highly advise don't go near the pelvis, because we'll talk about blood loss in a few minutes. Next thing, you can check down along the legs then, and you can check both legs down along and out on the feet as well. When you saw me doing my head to toe there, I was looking for deformities inside the body, any kind of broken arms, legs, any kind of limbs, anything that would indicate that the patient was seriously injured. Another thing what we're looking then is blood loss. So a lot of people bleed from the scalp, as you know, and a lot of people, a lot of older people on medication can bleed profusely from the scalp. So we have 3 different types of bleeding. You can see them here. We have a capillary bleed, which is an ordinary standard one. If you're shaving your face or shaving your legs, you might get a small little nick, and that's a little capillary bleed. The other one then is a venous bleed, which is dark red and flowing, and basically what happens is if you cut your hand, lots of people cut their hands, you know, with a penknife or doing the dinner, and you get this little wound that will ooze away. That's a venous bleed. And the more important and the more dangerous one is an arterial bleed. And trust me, if you ever see an arterial bleed, it takes massive amounts of pressure to stop it. While there's loads of fancy dressings out there and there's all the stuff, but I'm going to show you that another week when we're dealing with the patient. But today we had no blood loss. Hey guys, and thank you yet again for coming here tonight. So quick little recap. Patient falls over, stay as calm as possible, make sure you call the ambulance, keep the patient warm at all costs, and making sure you can use anything that's around the house just to keep them warm. Keep reassuring the patient. Another thing as well is, remember, they'll be unconscious on the ground, but keep talking to them, hold their hand, keep reassuring the person, because you could be waiting a period of time for an ambulance. If you like our video, please give us a like and a subscribe, and we'll see you for part 2 next week.